On the afternoon of Saturday, August 10th, 2024, Montgomery County Fire and Rescue Medic 723 was dispatched to a residence for a patient complaining of chest pain. Upon the arrival of Medic 723, firefighter paramedic Lightcap, firefighter paramedic Parlanti, and firefighter Constantino found a patient alert but in obvious distress. The patient stated that he was at his brother's house earlier in the morning and he had mowed his grass using a push mower. While the patient was mowing, he had sudden onset of severe chest pain, trouble breathing, and diaphoresis. The patient sat down until the pain decreased, and when he felt better, he returned to his residence. After returning home, the patient stated the discomfort continued, so he called 911 for assistance. The crew from Medic 723 assessed the patient and found him to be pale, diaphoretic, and hypertensive. The patient continued to complain of substernal chest pain and a tingling sensation in the left arm. A 12-lead EKG was obtained, and ST elevation was noted in multiple leads with accompanying reciprocal changes. The crew immediately transmitted the 12-lead to Shady Grove Medical Center for early activation of the cardiac catheterization lab. The patient was administered aspirin and moved to the EMS unit to prepare for transport to the hospital. In the back of the medic unit, the crew placed AED pads on the patient and attempted to start an IV. As the crew was working on establishing the IV, the patient had a sudden change in mental status, presented with a blank stare, and stopped responding to EMS crews. The patient then became unresponsive with agonal respirations and was noted to be in ventricular tachycardia on the cardiac monitor. The patient was cardioverted and converted to a pulseless electrical activity. The crew started to perform high-performance CPR. During the first round of compressions, the patient had a return of spontaneous circulation and regained consciousness. The patient became alert and oriented and converted back to sinus rhythm on the cardiac monitor. An IV was established, amiodarone was administered, and oxygen was administered as well. En route to the hospital, a second vascular access site was established and medical consultation was conducted with Shady Grove Medical Center. Upon arrival to Shady Grove, the patient was transferred to the waiting emergency department staff. The staff stabilized the patient and he was transferred to the cardiac catheterization lab where he had multiple stents placed. The patient was then transferred to the ICU. Firefighter Constantino, firefighter paramedic Lightcap, and firefighter paramedic Parlanti exemplified the highest standard of our profession during this incident. Their actions are a testament to their training, experience, and dedication to patient care. Thanks to the outstanding care provided, the patient was discharged home neurologically intact only 2 days later on August 12th. Montgomery County Fire and Rescue Service is proud to recognize our personnel for their dedication, professionalism, and teamwork.